In assessing the regional range of motion of the cervical spine from the occiput down to and including C7's motion over T1, we first must locate the spinous process of C7 and in T1. So we have our patient slowly, actively, within her pain-free motion, forward bend or flex their chin down, and we slide our fingers along the nuchal ligament, posterior spinous process until we find the most prominent spinous process, which typically in most patients is C7, and therefore we have the spinous process of C7, and the one below it is the spinous process of T1. Some physicians, I said earlier, will monitor the C7 by pinching the inner space between C7 and T1, and on forward bending within the patient's pain-free functional limit of motion, we have the patient forward bend as comfortably as possible, and we monitor and observe that motion. And the normal regional spinal motion for forward bending or flexion is approximately 45 to 90 degrees. Now we have the patient extend, and again, monitoring the spinous process of C7 and T1, and when C1 starts to move over T1, we ask the patient to stop, and again, backward bending should be a regional range of 45 to 90 degrees according to our PCOM criteria, and back to neutral.